So welcome to today's class. Today we are going to talk about sutures and knots. Okay. So I apologize for a bit delay in starting the class. Let me just check whether the streaming is okay and we'll just begin with it. Okay. So let me just check whether the streaming is okay. Okay. So right. So I'm live. So can I just hear from you guys, whoever is online? Can I just hear it from you guys, whoever is online? Can I just hear it? Okay. Okay, so let me just switch on the chat mode and then we'll be starting. Just give me a second. I will be connecting with you. By that time, if you have any doubts related to suture, if you want anything which you want me to cover, please do write it down. I'll be covering in this particular session. So I have made this particular session because everybody was requesting me about sutures and knots. So in this particular session, we'll be covering in detail about sutures and knots. Just give me a second. Let me turn on the chat option and then I'll get back to you. Till that time, you can just connect with me. You can write down anything you wish. Any doubts you have, do write down on the comment box. I'll be getting back to you. Right. So here I am. Can I hear it from you guys? So I see that 9 of you are watching me at this moment. So can I hear it from you guys? Okay, so we are 10 of us. So let us begin. And if you have any doubts, if you don't understand anything, please do put that up in the comment section. Okay, so let us start. So in this session, next 20 to 30 minutes, we are going to discuss about sutures and knots. So let us start talking about it. Okay, so this is how a suture comes. Okay, so I will be dealing with all the practical aspects and the relevant aspects for your surgery. Okay, for the surgery MCQs. Okay, I will not be covering the different types of knots. That is the horizontal mattress, vertical mattress, simple sutures, continuous sutures. I will not be covering that. But rest everything about the sutures I will be covering in this particular session. Okay, so if you have any doubts, if you want to ask me anything, do put it up. Okay, so let's begin. So what you're seeing on the screen, this is how a suture looks like. Okay, so this is how a suture looks like. And right, so everything which is written on the suture packet, it is of relevance. Okay, so we will be dealing with that, don't worry. Okay, now coming to this, so a suture can be either an absorbable suture or a non-absorbable suture. Okay, so what do you mean by an absorbable suture? Absorbable suture means it basically is absorbed from the body. Okay, and a non-absorbable suture, it remains in the body for the entire life. Okay, so it is never kind of taken out from the body. And what happens around the suture, there is forming of a capsule, and that particular suture converts into a inert substance and it stays in the body for the entire life. Okay, now even in the absorbable suture, what do we have? We have a naturally occurring absorbable suture and then we have a synthetic absorbable suture. Now this is very important. Okay, so we can have an absorbable and a non-absorbable suture, and in both, absorbable can be natural or synthetic, and a non-absorbable suture, even that can be natural and synthetic. Now let us focus our attention towards the naturally occurring absorbable suture. What do I want to convey is how is it kind of degraded. Okay, so please understand this. If you have a naturally occurring absorbable suture, what is like, how does it degrades, or how does it degenerates? So it degenerates with the help of a phagocytosis and enzymatic degeneration. So please understand that. So if there is a naturally occurring absorbable suture, the method by which it is degenerated, it is enzymatic degeneration or phagocytosis. But if you have a synthetic absorbable suture, then how is it degenerated? This is again very important. If you have a synthetic absorbable suture, it is degenerated with the help of hydrolysis. Okay, so naturally occurring absorbable suture, phagocytosis, enzymatic degeneration. Synthetically occurring absorbable suture degenerated with the help of a hydrolysis. Now why is it important? Because anywhere where you have an enzymatic degeneration, there will be more tissue reaction. So this is basically a drawback of a naturally occurring absorbable suture. That is, whenever it is degenerated or wherever it is absorbed, you have more tissue reaction. What about the synthetically occurring absorbable sutures? We will talk about the examples and everything. Just understand, whenever it is absorbed, the tissue reaction is minimal. Okay, so just understand till here. So till now, you all know that there is a natural like absorbable suture and a non-absorbable suture. Okay, so I hope you guys are understanding and making sense of it. I am not hearing from any of you guys. Is the chat on? Hello guys, can I just hear from you? Just interact with me a bit. Can I just hear it from you guys? Is it okay? Right? So can we move on? Okay, so let's move on and let's talk about it further. So what do we have? Still now what we covered, that the sutures can be absorbable and non-absorbable. What else the sutures can be? The sutures can also be naturally occurring, monofilament and multifilament. Okay, now this is something also which is important, but it is very simple also. So what do you understand by monofilament suture? If there is only a single strand of a suture, it is called as a monofilament suture. If there are multiple strands of the suture, then it is called as a multifilament suture. Now just understand one thing. If at all you have a multifilament, if you have multiple strands of the suture, how will it act like a one suture? So the only way it will act like one suture is it will have to be twisted on itself. Okay, so you will have to intertwine multiple threads on itself so that all of them together act as one unit. And that is why this is how a multifilament suture looks like. And this is our monofilament suture. Okay, so this is basically a diagrammatic description. So please understand, if you have multiple filaments, for it to act as a single unit, it has to be twisted over itself. Okay, so this is basically called as a braided suture. Please understand it. Okay, oh, I'm really sorry. This is basically called as a twisted suture. Okay, what else can you do? You can have the multiple filaments in one. Okay, so this, I'm talking about this now. So if you have multiple filaments which are running parallel to each other, but if you coat all these filaments with a coating outside, then what do you call it? You call it as a braided suture. So please understand, the multifilament suture can be of various types. Just understand, what you are seeing on this particular figure is a braided suture. Now this is something which is more deeper, might not be needed to you, but just understand, a multifilament suture can be twisted or a braided suture. Please understand this. Okay, right. Now this is, we talked about there can be an absorbable or non-absorbable suture, and we talked that there can be a monofilament or a multifilament suture. Okay, so these can happen. Now let us talk about the monofilament suture. What do you understand by the monofilament suture? So monofilament sutures, what is a monofilament suture? Let's just talk about this. So I just talked about it. What are the advantages of a monofilament suture? This is important. Now this is simplified suture, that is fine. It has less resistance. So if you pass it through a tissue, the monofilament suture tends to pass very easily. So it has less resistance. It has better ability to slide. Again, the same thing, it is more smoother, so it will pass through the tissue very smoothly, and it will lead to less friction. So the friction between the tissue and the suture material, it will be less. Okay, it will cause less trauma to the surrounding tissue. So the trauma which is caused due to the passage of the suture, that will also be less. And another very important thing is that it has very less capillary activity. Okay, so you understand what is the capillary activity? The ability to pull the kind of a fluid along its particular course. And because of this, what happens? The chances of infection are very less with monofilament suture. So what are the advantages? It passes very easily. It causes less tissue kind of injury, and it has okay, so the chances of infection are very less if you use a monofilament suture. What is the disadvantage of a monofilament suture? Now this is very important, the knot. Okay, so the knot is more likely to come out. Okay, so if you tie a particular knot, the knot is more likely to untie itself. So the knot security is less in monofilament suture. And what else? Okay, so if at all you catch hold of this particular monofilament suture with the help of a kind of a needle holder or something, it breaks very easily. Okay, so it breaks very easily. This is not important, that is fine. The only disadvantage which you have to remember is that the knot security is very less. If you tie a knot, it has more tendency to untie itself. Okay, so this is important. Please understand this. Then what else? this is about the monofilament suture. Now let us talk about the multifilament suture. Now what is the advantage of a multifilament suture? It has a greater tensile strength, because in the monofilament suture you had only one kind of filament. Here you have a multiple filament. So the tensile strength of the suture increases. Now it is more pliable, so that you can, twist and turn this particular multifilament suture in a better fashion. Okay, now it is flexible, that is all fine. Important, very very important, it has a better knot security. So if you tie up a knot, it is more likely to kind of be like tie itself, like it is unlikely that it will untie itself. So the knot security is much better with a multifilament suture. What is the disadvantage of a multifilament suture? So it has a high friction. If you pass it through the tissue, it causes more injury to the surrounding tissue. This is one of the disadvantages. Okay, and what else? Another important thing is the chances of infection. So please understand, because the capillary action is more with the multifilament suture, the chances of infection are much more with the multifilament suture. So this is again very very important. You have to understand the basic advantages and the disadvantages of monofilament and a multifilament suture. Now this is absolutely important. Now let us talk about the sutures proper. So as I told you, there can be absorbable and a non-absorbable, and there can be synthetic and a natural. Now in this table, we have divided the sutures into naturally occurring and a synthetic sutures. Okay. Now first let us talk about the naturally occurring suture. So naturally occurring suture can be absorbable. So the first absorbable suture which we have is the first absorbable suture which we have is the catgut. Okay. So what is catgut? Catgut is a suture which is derived from the gut of the intestine. Oh, sorry, intestine of the sheep. Which part of the intestine of the sheep? The submucosa of the intestine of the sheep. Okay, so please understand this. This is a naturally occurring absorbable suture. Now, very very important MCQ is, what is the preservative which we use to preserve the catgut suture? So the preservative which we use to preserve the catgut suture is isopropyl alcohol. What is it? It is an isopropyl alcohol. Please understand this. What about the, okay, right. So this is about the plain and the chromic both. Now what is this chromic catgut? So the plain catgut, it absorbs very rapidly. Okay, so its tensile strength reduces within 7 to 8 days, and it gets absorbed within 7 to 14 days. Okay, 10 to 14 days. What about this chromic catgut? If you coat the normal catgut with the chromic salt, it increases its absorption time. Okay, so that is what you mean by the chromic catgut. So chromic catgut is nothing else. It is just that the normal catgut suture, it is coated by the chromic acid, kind of the salt, the chromium salt. It has been coated with it in order to increase the absorption time. That's it. Okay, right. So I welcome all of you guys. Good evening. All of you are wishing me good evening. All of you guys. I'm really happy that to have you guys. I'm just doing it in a fast manner because your exams are very near, and I don't want to waste any of your time. So I'm not interacting with you guys today much. And right. Okay. So how to sterilize the catgut suture? By the air radiation. Okay, so whenever you have a suture, it is sterilized by the air radiation. Okay, so it is sterilized by air radiation. Please understand this. Okay, right. So moving on further, so this was about the naturally occurring absorbable suture. Now what about the non-absorbable sutures? What are the naturally occurring non-absorbable suture? We have a silk, we have linen, we have a stainless steel. Okay, so please understand this. What is the silk? It is a multifilament non-absorbable suture. That is fine. What about the stainless steel? Where do you use the stainless steel? After the sternotomy. If you do a sternotomy to kind of get the sternum back together, you use stainless steel. You also used to use it very back into the, like around 70-80 years back in the hernia surgeries. Yes, you used to use it, but no one uses it now. Okay, right. Now let's talk about the synthetic sutures. Now synthetic sutures can also be absorbable and a non-absorbable. Now let's talk about the synthetic absorbable suture. Do you remember something about the synthetic absorbable suture? How is it absorbed? By what mechanism it is absorbed? Can you tell me, guys? Okay, so can you tell me by what mechanism it is absorbed? Anybody? So, well, yes, synthetic, synthetic absorbable suture. Okay, right, hydrolysis, very good, right? Hydrolysis. Madhu, very good. Now, Amnit, you are asking me to show the surgical blades with their numbers also. Okay, so I will try to show it to you. in the next session. Okay, in this particular session I really don't have it, I'm really sorry, but in the next session I'm doing a session on the surgical instruments at 5 o'clock. So you please come there, I'll definitely show it to you, don't worry. Okay, now I'll talk about everything about the surgical blades and the handles which we use. Just come on the session at 5 o'clock. Continuing with the sutures, very good, the answer is in fact hydrolysis. So what is this hydrolysis? Please understand thing. Okay, right, so what is the advantage of hydrolysis? You remember that the tissue reaction was very less. Now let us talk about what are the synthetic absorbable sutures. So we have, so please understand, you must be knowing all these sutures by the name Vicryl, PDS, Maxon, Daxon, all those things, but please understand at the same time you also need to understand the chemical structure of these. Okay, so what is important? Monocryl is important. So what is it? Polyglycoprone. Please understand, polyglycoprone is monocryl, one and the same thing. I'll talk about it, don't worry. What about Vicryl? Vicryl is polyglactin, or if at all you have a okay, so polyglactin, please remember it as a polyglactin. Okay, and what about this PDS? It is polydioxone. Don't, if at all you don't remember much about it, that's fine. But one thing you have to remember is, what is a delayed absorbable suture? So answer is PDS. What is the absorption time of PDS? It is around 180 days. Okay, so please understand that. What about the absorption time for Vicryl and monocryl? It is close to 60 to 90 days. But please understand, I'm talking about the absorption time. I'm not talking about the tensile strength. Tensile strength is something different. Now here you need to understand this. There is a difference between a tensile strength and there is a difference between the absorption time. What do you understand by the absorption time? The time after which the suture disappears from the body. That is what you call as an absorption time. What do you understand by the tensile strength? Tensile strength is a time after which even if the suture is physically present in the body, it is not able to do its purpose. What is the purpose of the suture? Its purpose is to put the tissues together. But a point will come when the strength of the suture will reduce. Even though it is physically present, it will not be able to approximate the edges of the wound. This is what is called as an tensile strength. And what do you understand by the absorption time? Absorption time is the time after which the suture completely disappears from the body. So that is different. Now why I'm stressing it over here is because you have been asked what is the tensile strength of Vicryl. So please understand, the tensile strength of Vicryl and monocryl is between 3 to 4 weeks. Okay, tensile strength of Vicryl and monocryl is 3 to 4 weeks. The tensile, but the absorption time for the Vicryl and monocryl is kind of 60 to 90 days. I hope you understood this. Okay, so everybody understood the concept of tensile strength and right, absorption time. I hope everybody understood this. Now the last category is non-absorbable suture, synthetic appearing. So what is the synthetically occurring non-absorbable sutures? We have nylon. What is nylon? The name of the nylon is polyamide. And what else? You have proline. What is proline? Polypropylene. So proline and the polypropylene are one and the same thing. Okay, so we will talk where these sutures are used in some while. For now, just understand what is the kind of the name of the suture and what is the chemical constituent of that suture. Now moving on. Now this is basically what we talked about till now. This was about the thread. So what do we have? In the suture we have the needle and then we have a thread attached to it. Whatever we talked till now, it was all about the thread. Now let us talk about the needle. So what about the needle? So there is a point, body, shaft, whatever, all these things, it's fine. What is important is where will you hold the needle? So please understand, you hold the needle 2/3 from the anterior portion and 1/3 from the posterior portion. So please understand. Okay, so the posterior portion is called as the swage end, that is fine. But please understand, the distance from this pointed end towards the, between the needle holder and the pointed end, the distance should be 2/3 of the entire length of the needle. This is important. Why is it important? Because if you kind of hold it more anterior or more posterior, it will be difficult for you to take the suture and the needle can bend. Okay, so these are the two reasons why you hold it at 2/3 and 1/3 distance. Okay, so please understand this. Now let us talk about the tip of the needle. So please understand, the tip of the needle can be taper point, blunt point, or it can be cutting or a reverse cutting. Now please understand, where do you use a cutting? Where do you want a cutting or a reverse cutting needle? So wherever you have any tough structure to enter. Okay, so what are the tough structures in our body? We have a skin, we have sheath, we have nerves. So skin, sheath, nerves. If you want to enter into these tissues, you will use a cutting or a reverse cutting needle. Okay, right. What about the taper point? We'll talk about the taper point. Now let us talk about the blunt point. So where will you use a blunt point? So wherever you have kind of a soft tissue to enter. So what are the soft tissues where sutures can be taken? So muscles, GIT. Okay, so muscles, GIT. If you want to take up a suture over here, you will use a blunt point needle. Please understand this. Now what about the taper point? Now we as human beings always want more. So okay, before talking about the taper point, what is the disadvantage of a cutting or a reverse cutting needle? The basic disadvantage of using a cutting or a reverse cutting needle is that it cuts the tissue. Okay, so it basically cuts the tissue, which will basically cause the local trauma wherever you pass the needle. Okay, that is the disadvantage of a cutting needle. What is the advantage of a blunt needle? The advantage of the blunt needle is it splits the tissue, it doesn't cut the tissue. So the local trauma caused by the blunt point needle, that is less. Okay, now, but what is the disadvantage of a blunt point needle? It cannot enter into the tough structures. Now we as human beings, we always want more. So what do we want? We want the advantages of a cutting as well as the blunt needle. So for that you have a taper point. What do you understand by the taper point? If you have a pointed end, it will easily enter into the tissue, and if you have a kind of a kind of round body, it will cause less trauma to the tissue. Please understand this. So what the baseline which you understand, which you need to remember from this slide is that we can have a cutting, which can be a cutting or a reverse cutting, a conventional cutting or a reverse cutting. Then we can have a blunt point, and we can have a combination of both. That is basically taper point. So the point that the end of the needle, it will be pointed, but the rest of the needle will be round bodied. Please understand this. Okay, I hope you understood this. Now another thing is they might show you these symbols. Now every symbol is not important for you. What is important is this: if you have a normal triangle, it is a conventional cutting needle. If you have an inverted triangle, it is a reverse cutting needle. If you have just this circle, it is a blunt point needle. And if you have a circle with a point between in it, so that is basically a round body with a taper point. Okay, so only these upper four, if you remember these four, you are good to go. I hope you understood this. Okay, so whoever is listening, can I have a thumbs up from you if you understood this point, so that I can move on to the next thing? Can I have a thumbs up, guys, if you understood this? Right, please cooperate, guys. Can I have a thumbs up? Right. Okay, so let's move on to the next thing. Okay guys, so let's move on to the next thing. So the next slide is okay. So okay, now before talking about this, let us talk about this. Okay, so what do we have? We have different sutures which can be used for different surgeries. Okay, so what is the suture which we use for the bowel anastomosis? It was recently asked. So what is the suture which we use for the bowel anastomosis? We use Vicryl. Okay, so Vicryl is the suture which we use for the bowel anastomosis. What about the bile duct or the biliary surgeries? We use Vicryl, but we can also use PDS. Okay, so please understand, we use Vicryl, but we can also use PDS. What about the pancreatic duct? Okay, proline, yes, we can use it. Along with that, what else you can use? Along with the proline, you can use again, PDS can be used. Okay, so monofilament sutures can be used for that. Okay, so proline is usually not used. What we use is a PDS. Please understand this, guys. What for the vascular surgeries, definitely we use proline. For the hernia and the mesh repair, we use proline. For the abdominal wall closure, to be specific, for closure of the sheath of the abdomen, we use proline. So what was proline? Do you remember, guys? Proline was a non-absorbable monofilament suture. That is basically a proline, and that is used for the vascular surgery, it is used for the hernia surgery, and that is also used for the abdominal wall closure. Okay, so please understand this. Okay, so I hope you understood this. What about the subcuticular suture? The subcuticular sutures which we usually take after LSCS. Okay, anywhere you want a cosmetic scar, you use a subcuticular suture. And what is a suture material which we use for that? We use monocryl. So this is a list. Just change this pancreatic duct. Usually proline is not used. What we use is a PDS over there. But yes, these are the sutures which are used for particular indications. I hope you understood this. Okay, right. Now after this, I just wanted to show this. Now if you just pay a close attention towards this particular pack, what is present on the tip of that? You are having two needles. I hope you can appreciate. At the end, there are two needles. I'm really sorry today I don't have my stylus, so I cannot write and tell it to you. But please understand this. At the end, what do we have? You have two needles. Now, usually what do we have? We have only one needle, okay? So please understand this. I'll try to make you understand. So when we have only one needle, okay, so a normal suture, it has only one needle, okay? So please understand this. But here, in this particular thing, what do you have? You have two needles. Why do you have two needles? What is this suture? This is a proline. So this is basically a proline suture which is specifically used for the vascular surgery. For the vascular surgery, why do you have two needles? Please pay attention towards this. Because whenever you do a vascular surgery, you pass your needle from within outwards. Okay. So I'm really sorry guys. Okay. So I don't have a paper at this moment. I'll just try to make you understand. So what do we have? We have this okay, so I have a napkin over here. So I'm just rolling it over here. So what you do is, whenever you pass a needle, you pass from within. From the lumen, you come out. That is within outwards. Okay. So this is what you do whenever you take a vascular surgery. Why? Why is this? Because if you go from outside to inside, what will happen? The mucosa might bump up, and that will cause haphazard or random flow of the blood, which will basically increase the chances of coagulation. It will cause endothelial damage, and virtue triad, you can correlate with that. So that is the reason why you come from within outwards. Okay. But whenever you do a vascular surgery, you don't have only one end. Okay. So you have two ends. So if you have passed the needle from within outwards over here, you will have to go from within inwards if you use that particular same needle. Okay. So that is the reason why you have two needles, because one needle you can pass from within outwards over here, and the other needle you can pass from within outwards over here. I hope you understood this. I'm really apologizing because I'm traveling. I don't have my stylus today. I cannot draw and tell it to you, but I hope you understood this. If you understood this, just give me a thumbs up so that I can move on, guys. Okay. So can you please tell me, guys, did you understand the concept of this? I just wanted to give you this extra point that whenever you have a proline suture for the vascular surgery, at the end you have two needles. The reason you have two needles is because you want to pass the suture from within outwards. Okay, so I've got a couple of thumbs up. I'm really happy that you understood. Good, great. Now the last point which I want to tell you is, when will you remove the sutures? So please understand, when do you remove the sutures? So if at all you have taken up a suture in the face, you remove it between 3 to 5 days. On the scalp, you remove it between 7 to 10 days. That is fine. Arms, again 7 to 10 days. Okay, so in the scalp, usually it is between 6 to 8 days. Okay, so please understand, please kind of change this. On the scalp, you usually remove it between 6 to 8 days. In the abdomen, if at all, trunk. Okay, so here the abdomen is not there. Please, again, pardon me. This table doesn't have abdomen. So whenever you have a suture in the abdomen, you remove it between 8 to 10 days. Forget about the table. Just listen to me. In the scalp, you remove the sutures between 6 to 8 days. In the abdomen, you remove the sutures between in the scalp, you remove the sutures between 6 to 8 days. Yes. In the abdomen, you remove the sutures between 8 to 10 days. About the trunk, that is the back and everything, 10 to 14 days. And the palms and the soles, it is okay, 14 to 21 days. In the face, it is 3 to 5 days. Indirectly, how they can ask you? They can ask you that when will you remove the suture after the cleft lip repair. So after the cleft lip repair, you remove the sutures within 3 to 5 days. Okay. So please understand this. This is an indirect question which can be asked, because on the face you are removing the sutures after 3 to 5 days. Please understand, and please remember the scalp, that is 6 to 8 days, and the abdomen, that is 8 to 10 days. I hope you understood this. Okay, right. So this, okay, so this was all about the sutures and everything. Now let me talk about the knot. Okay, so everybody understood till here? Everybody understood it, guys? Can I have a thumbs up? Okay, now what I'm going to talk about, that is very, very important, and many students have kind of a doubt in this. So please stay tuned. I just want to hear it from you guys. Everybody is still here so that I can move on. Okay, right. Okay, so let's talk about this. So what do we have on this particular slide? Can anybody tell me what kind of knot it is? Anybody? Can anybody tell me what kind of knot it is on the screen? So what do we have? You have a secure knot and you have a non-secure knot. What are the types of the secure knot? The types of the secure knot are, it can be either a square knot or a reef knot, or it can be a surgeon's knot. First and foremost, just understand these things. Okay, so whoever has answered this particular question as a surgeon's knot, he's right. But whoever has answered that as anything else, let's say a reef knot or a square knot or something, that is wrong. So please understand this. Make the basics clear in your mind. What are the types of knots? We have a non-secure knot and we have a secure knot. What about the secure knot? In the secure knot, it can be either a square knot or a reef knot. Square and a reef knot, they are one and the same thing. Or you can have a surgeon's knot. So please understand this, okay? I'll repeat, you can have a non-secure or a secure knot. In the secure knot, what are the examples? You can have a square knot or a reef knot, one and the same thing, or you can have a surgeon's knot. What about the non-secure knot? In the non-secure knot, what is the kind of knot we have? We have granny's knot. Please understand this, okay? So in the non-secure knot, we have a granny's knot, okay? Did you understand this, guys? Right. Okay. Very good, guys. Now let us talk about these particular things, okay? So I hope you understood here. Now whenever you get any figure like this, what is the first thing what you want to see, which I want you to see? So please understand, forget about the surgeon's knot and everything, just understand one thing. Whenever you get any figure like this, what is the first thing which I want you to see? The first thing which I want you to see is this, okay? So what do you have? You have a loop over here. This loop is formed by the blue colored loop, okay? So I hope you understand this. This is a blue colored loop. Please pay attention on the screen. What do you have? You have this blue colored loop and you have this, this also consider it as a blue, okay? So please understand, please consider this also as a blue. Now, if you pay attention towards the above figure, what is happening? The red colored suture, both the kind of sutures or both the threads are either going above the loop or both the thread are going below the loop. I hope you understand this, okay? So please understand, if you have both the kind of threads which are going in the same direction, in other words, if both are going above the loop or both are going below the loop, this signifies that it is a secure knot. This doesn't signify that it is a square knot or a reef knot or a surgeon's knot. It just signifies that it is a secure knot. Now, if you pay attention over here, this is granny's knot. So if you pay attention towards this reddish pink kind of a thread, one thread is going below the blue colored loop and the other thread is going above the blue colored loop. So if you have a thread, one is going below, one is going above, this is basically what you understand by the granny's knot. Please understand this, okay? And if both the threads are going above or both the threads are going below, this is what you understand by the secure knot. So granny's knot is a non-secure knot. In other words, it will easily kind of get loosened up and it can easily be removed, okay? So please understand this. What about the secure knot? You cannot untie that particular knot very easily, okay? So please understand the basic difference. What is the basic difference? If both the threads are going either above or both the threads are going either below the loop, it is a secure knot. If one thread is going above the loop, one thread is going below the loop, this is what is a non-secure knot. I hope you are all with me till here. Everybody understood when you will call it as a secure and a non-secure knot. Now we'll talk about the secure knot. Please understand this. Just give me a thumbs up if you all are here, all are with me till here. So everybody understood how you will kind of diagnose till secure or a non-secure knot. We will talk about the secure knot in detail. For now, just tell me, did you understand till here? Can I hear it from you guys? Okay, so this is just a minute, guys, just a minute. Okay, so everybody still with me till here? Okay, now what did I tell you? What are the two types of secure knot we have? We have either the surgeon's knot or we have a square knot. This square knot is also referred to as a reef knot. Now it is very simple to distinguish between a square knot and a surgeon's knot. Are you seeing these loops over here? So what do we have? You have only one loop, okay? So again, I don't having the stylus, so it is a bit difficult, but please understand one thing. Just have a look at my cursor. So what you have over here, this is only the one loop, okay? So if you have only the one loop in both the kind of threads, okay? So above and below, you have only one loop. This is a square knot, and this square knot is also referred to as a reef knot. But if you look over here, what do we have? You have one loop and then you have another loop. So if in the first time you have two loops and in the second time you have only one loop, this signifies that it is a surgeon's knot. Now this is a very crude method for making you understand, but this is what they ask you, okay? So they just give you the figure and they ask you which kind of knot it is. They ask you whether it is a surgeon's knot, they ask you whether it is a reef knot, or they ask you whether it is a granny's knot. So I hope you understood this. Everybody understood this? Anybody who did not understand this, please ask me. I'll definitely explain it again, but I hope you understood this. Till I get your reply, I'll just repeat it for you. What you have types of knots are, it can be either a non-secure knot or a secure knot. In the non-secure knot, what is happening? In the non-secure knot, the loops, the threads, both are going above or both are going below. I'm really sorry, this is about the secure knot. Please pardon me. In the non-secure knot, what is happening? One thread is going above the loop, another thread is going below the loop. But what is happening in the secure knot? Both the threads are going in the same direction. If both the threads go either above or both the threads go either below the loop, you diagnose it as a secure knot. Now the next step is to distinguish whether it is a surgeon's knot or whether it is a square knot or a reef knot. So when will you call it as a square knot or a reef knot? If there is only one loop. If there is only one loop, you will call it as a square knot or a reef knot. But if there are two loops, as you can see in this particular figure, so this is your one loop and this is your second loop. Okay, so this is what is a surgeon's knot. Okay, I hope you understood this. Everybody got this? Can I hear it from you guys? Can I get a thumbs up if you got this, guys? Square and granny's look, no, not at all. Okay, so Raghu's square knot and granny's knot, they don't look alike. Please understand this. The basic difference is just okay. So on this slide, what you're seeing now is a square knot and a granny's knot. So please understand this. Just have a look at this particular red thread, and this is the blue loop. For simplicity, I understand. I know this is pink, but please understand. Please consider it as a red, and please consider this as blue. So if you look at the above figure, what is happening? Both the red threads are going above the blue loop. But if you look at the figure which is below, what is happening? One red thread is going above the loop and the another red thread is going below the loop. Okay, are you understanding, guys? So if both the red threads are going in the same direction, they can both go either above or they can both go below. But if one is going above, one is going below, this is a granny's knot. If both are going in the same direction, I mean both are going above or both are going below, then it is a square knot or a reef knot. Did you get your understood? Right. Anybody else? The surgeon's knot different from reef knot? Yes, surgeon's knot is different from reef knot. Square knot and the reef knot are one and the same thing, but the surgeon's knot is different. Please don't confuse within the terms. Square knot and the reef knot is exactly the same, but surgeon's knot is different. Did you understand it, Rudra? Rudra, did you get it, guys? Okay, right. So I hope you understood this, guys. Okay, thank you so much, guys. I hope you liked it. Okay, yeah, this is again the figure of a granny's knot. You can see that the red thread, one is going below, one is going above, and there is a blue colored loop. Okay, so this is a non-secure knot or a granny's knot. I hope you understand it. Okay. Right. So thank you so much, guys. This is what I wanted to cover because many of you have requested me to cover the sutures and the knots and everything. So I hope you understood this. If you have any doubt, just put it up on the comment section. I will definitely try to answer it. And somebody of you requested me to cover the blades and the handle. I will be covering it in the session which will be starting close to around 5:15 or 5:20. The session will be starting and I will be covering in that. Okay. So please stay with me, guys. And thank you so much. I hope to join you there also. That session again will be around half an hour session on the instruments. Okay, so you can come and join me over there. Okay, thank you so much for joining with me today. I hope you have a great time. And sir, I asked about what is the difference. Okay, what is the difference? Okay, what is the difference? Okay, so you mean what is the difference? Okay, so see, understand. Surgeon's knot is more secure. So both are secure knots, but this is how you take up a surgeon's knot. Okay, so okay. What is the difference in the technicalities? So when you take up a suture, in the first time you go for 2 throws, and okay, so in the first time you go for 2 throws, and on the next time you only go for 1 throw. Please understand the difference. Okay, in the technical terms, if you take only 1 throw and then you take only 1 throw in the next time, it is a square or a reef knot. But if in the surgeon's knot you are taking, you take 2 throws. If you are an intern and you have taken up a suture in the casualty, you will definitely correlate what I'm trying to tell you. I don't have a suture at this moment. Okay, so I'll just try to demonstrate it to you. So if this is a suture and if this is a needle holder, what you do whenever you take up a surgeon's knot, this is the first throw, this is the second throw, and then you catch hold of the suture and you bring it out. Okay, don't go into the details. For the NEET exam, all what you will be asked is you will be given these 3 figures and you will be asked to distinguish between them. I can very well tell you what is the difference in the kind of a practical point of view. the basic difference is in the surgeon's knot you take 2 throws, and that is why it gives you 2 loops in the first time, and in the second time you take up only 1 throw in the reverse direction. But please don't go into the practicalities. For you, for this particular NEET exam, all that is required is this image, and for you to understand what is this particular kind of a knot. I hope you understand this, and when you come into the clinical practice, this is nothing. It is a very simple thing. Okay, so the basic difference, I just submitted one line. The basic difference is in the square knot, if you take 2 throws, that is on the first time, that makes it a surgeon's knot, and if you take only 1 throw, that makes it a square knot. Both are the secure knots, but the surgeon's knot is more secure. That is all you need to know. Okay, so did you understand it? I hope you understood it. Okay, no, 5:15 over here, guys, on the YouTube itself. Okay, right. So next class on Unacademy on first I will be discussing, most probably on first I will be discussing about the grant test, the free grant test, which is being conducted on 29th on the Unacademy. It's free for all of you guys. The explanation of that will be available in the special class, most probably conducted on first. Okay, so I hope you understood it, guys. Have a great day, happy studying, and continue to read well. You will definitely do great. All the best, and yeah, continue the revision. Very less time is remaining, and thank you so much for joining with me today. I'm really happy to see around 50 students have online, so I'm really happy to see that, and I hope it helps you. And yeah, I hope I was able to add some value to you. Okay, so thank you so much, and hope to see you after half an hour on the YouTube session only. Thank you. Bye.